Hi, I'm Sarah Aguilar from LIV NRG, and today I'm at the Health Optimization Summit in London with Ricky Warren, the movement coach and biomechanics specialist. So tell me a little bit about what you do.
So essentially at the moment I do actually qualify trainers in a mobility and rehab system in my own certifications. So I'm educating the fitness industry on some of the most important aspects of performance and rehabilitation. I'm a calisthenics expert, I do yoga and martial arts and things like that. And generally what I do at the moment mostly is people will come in for assessments. I'll assess their spine and all the joints of their body, see where there's dysfunction and help them to rehabilitate those issues so that they can go about their daily lives or performing their sports and activities without pain and difficulty. 99% of people, including myself, and I would go as far as to say 100% of people need some form of rehabilitation, because nobody's body is perfect. Everyone's got the little niggles and aches and whatever's going on. And people often say, oh, you know, I want to train so that my right arm is just as strong as my left and I want to be symmetrical. But when you think about it, you've got one dominant arm, your liver's on this side, your heart's slightly there. So we're not symmetrical beings, but training symmetrically can help us to address imbalances. And imbalances are the major cause of dysfunction, which turns into injury.
And is that from the way we sit and move today that causes all those imbalances and expresses through dysfunction?
Definitely.
So what can we learn from our ancestors about how to move?
Depending on how far you go back, and depending on what kind of theories you prescribe to, maybe evolution from monkeys or not, things like that. Now nowadays we seem to be much more immobile than our ancestors. So ancestors would be hunting, running over large distances, climbing, squatting a lot more. They don't have chairs, right? They just sit on the floor on things. So we've lost a lot of these ranges of motion in our joints.
So we're just moving in one or two directions.
Yeah, planes of motion.
The full motion of our body.
Yeah. So the planes of motion describe different directions we can move in, but when you look at the joints specifically, they're mechanically capable of different directions. So the spine, being a pivot joint, can do this and rotation, but the elbow can only do this because it's a hinge. So with the elbow and knees, because they can only do that, people tend to get less issues in those. The knee's a bit more unstable, so it can be an issue. But hips and shoulders specifically, got such a large range of movement, often that range is decreased, and where it's decreased, if we're forced into a range that we don't have control or access to, that's where we get injury. Does that make sense?
Okay, and you were saying about overuse earlier in your workshop, where if you're doing everything this way, then you just get stuck in this position. And the same with like sitting at a desk, you're always bending forwards, and how you've just got to undo that. And do we need to move more like animals?
Yeah, I mean, not so much as animals, but animals express much larger ranges of movement than we do because of the way that they live in nature and move around. That we have habitual movement patterns. So we get up in the morning in the same way, we roll to one side, right? We brush our teeth in the same way. No, nobody does this and changes the angle.
The same patterns, right? That are quite limited compared to what our ancestors would have done.
So there's a couple of common issues that people that sit at desks for a long time will experience. One of them is called forward head syndrome, but it's affectionately known as text neck. Because it's when you just do this, right? So you're hinging and hanging off of your C7, T1 vertebrae, when essentially you should be actually like this. Does that make sense?
Are you realigning your spine?
Yeah, my cervical spine, I'm just pulling my neck in. So rather than hanging, we're using more poise and structure, posture.
So that's one thing people can do then when they're on their phone. Instead of looking like that, just realign slightly.
And what you don't want to do actually is stretch your neck like this, because that's going to exacerbate the issue. You need to strengthen it in terms of poise. And what you might find is that you have tight muscles here from being stuck here all the time, because they're going to shorten. So by releasing these muscles and massaging your neck in the front, you're going to allow better movement to pull your neck backwards.
So you've got to actually massage here?
Yeah, you're going to massage at the front.
So try that when you've been on your phone for too long and realign the spine.
I mean, a better thing than to just massage it would actually be just to pinch them. So this is called sternocleidomastoid.
Pinch them.
Yeah, it's called sternocleidomastoid, SCM. You just grab it like this and squeeze it. Make sure you're not choking yourself here. Yeah, you just squeeze it.
So you gently squeeze,
squeeze that. hold it for 30 seconds. Then I want you to lean back like this so they go long and keep hold of them 30 seconds. And then let go of them. After that point, you would have had a good release there. Once you've done that, then you can start doing some strengthening stuff. So if you just put the hands on the back of your neck and go into this hinge, and what we're going to do is just push back against the hands like this and tuck the chin in. So push down with the hands and then resist with your head and pull it back. So you can feel those muscles in your, and we don't want to move from your spine here. So if you keep your core nice and tight.
Just this bit.
And just move the neck backwards against the resistance of your hands like that. You feel that?
Yeah,
and just resist the urge for your core to come out, because then you're moving from a different part of your spine.
Yeah, that feels really solid. So you could do those two movements at your desk even.
Yeah. Another example is upper crossed syndrome. So it's called upper crossed because the fascia here in this cross shape, they pull you like this.
So can you explain what the fascia is?
The fascia is being, that's difficult, but
it's like the webbing, isn't it?
It's the webbing that covers the whole body, and it permeates every layer of tissue in your body. It's like a big bag, cellophane bag that holds you up, and it's stretchy and it retains memory of movement. So if you move in certain directions, it will get used to those. And the fascia, because it's like a sheath over every different layer of tissue, sometimes it sticks to tissue. And that will block the actual movement. You have to release the fascia from it so you can have gliding, and then you can
So that will cause restriction, stiffness, and even joint pain.
That's it.
Or it feels like joint pain, but actually it's the fascia.
That's it. So then upper cross syndrome is where you've got tight fascial lines across here. So where you've been on your keyboard hunched over, these fascial lines get tight, and then the muscles underneath them also get tight. So two good exercises for this would be a pec stretch. So you'd want to go against the wall here, and then just stretch your pec through the wall.
So just up here.
Yeah, just pushing your chest through, or like a doorway.
Would you twist at the same time?
Yeah, you can twist away a little bit as well, to open it up a bit. And then the other aspect is your shoulders would become internally rotated from being here. So we want to train external rotation. So you don't have to do it with a resistance band, but it's ideal. But you just get your arm here, and then you want to keep your scapula down, so you can put your hand up here. Yeah. And then you just want to rotate your arm back like this. And you feel the back of your shoulder working?
Yeah.
And even if you grab a little dumbbell or a can of soup at lunch or something, anything, or a bag, anything.
You can do this at your desk.
Yeah, even with a little carrier bag with something in it, just lift it up like this. And you'll feel the muscles here, the rotator cuff, giving you external rotation. And the result of stretching your pecs and externally rotating your shoulder will stop you from being here and bring you into more of this position. Does that make sense? And then you can be like this. So, but one of the
protecting your spine.
Protecting your spine. So look, a lot of the time people ask me, should I sit like this, and be conscious of that? But the whole issue with that is that it's a ball ache, right? Nobody actually wants to sit like this all day and do this, right? Because you'll forget after a while and you're not comfortable, and it causes different discomfort. The point is, we need to be able to hold ourselves in a different position subconsciously, and that takes specific types of training of the nervous system, so that when you're in this pattern, when I said pattern, that means neuromuscular pattern. Your nerves are used to firing these muscles because you're used to this. When you train your nervous system to be in a different position, your subconscious will hold you like that. But just doing this every day is not going to do it. You have to do the exercises.
You do those exercises, and that trains the subconscious.
They send stronger signals, exercises, than just sitting upright. That's a very weak signal to your nervous system. Doing something against resistance sends a very strong signal and rewires your nervous system.
That's really useful then. So if you practice those movements, then it's easier to hold this more aligned posture, to feel stronger and solid and not degenerate your back, essentially. One of the things that you talked about earlier in your workshop that I loved was the anti-aging movement for the spine. Could you demonstrate that, please, and show us how that works?
So, when you consider the spine, your nervous system passes through this, your circulation, all of your system flows through this. When your spine is straight, your organs hang in the way they're supposed to. You don't get tightness on one side or the other. So there's a lot of good stuff to be said about having a flexible, movable spine. The spine is it operates like a fishing rod. So the tension is braced through the spine. And if some parts of your spine are rigid or not mobile, and you try to put force through that like a fishing rod, it's going to snap. That makes sense?
So you want to avoid injury by
keeping
mobility.
Exactly. So you want to have a bendy, flexible, but strong spine like a fishing rod. So one of the good exercises you can do for that is called Spinal Waves. So I'll just demonstrate that now.
Yeah, let's do. Ricky's going to demonstrate 2 spinal mobility exercises to promote anti-aging in the body and spine.
Cool. So first we're going to go into this position called quadrupedal. So we go on our hands and knees like this.
Okay.
And you'll notice how Sarah's shoulders are on top of her wrists and the hips are on top of the knees, yeah? And then from this position we're just going to do a basic cat-cow.
Okay.
So flexion of the spine is when we're going to pull everything in the front inwards and round off the spine, including the sacrum, as much as possible. And what we don't want is a shifting of the shoulders or the hips off of their respective bases, so that only the spine is moved, yeah? And after this position here, we want to go into spinal extension, which is where we drop down through the spine, through all the segments, including the neck, and lift up, and that's spinal extension. And then we'll go back into flexion, and then breathe out, and then back into extension. Yeah? So by moving our spine in these 2 directions, we express 2 very important directions of the movement in the joints, flexion and extension.
So would you do that just in the evening, say, or the morning?
You can do, morning is better, and then evening will be good before you go to sleep. It will help relax your body and get the signals flowing better. So now we're going to use spinal wave. So the difference here is where we were doing flexion and extension before, now we're going to compartmentalize the flexion and extension into a wave.
Yeah.
So it actually moves partly through the body like this. So we would start like this. We can bring our arms out to help. You want to hollow your body from the top, yeah? And then if we start to now push the chest out.
Push it out with the arms like
so
this?
pull the arms back and push the chest out. And now the ribs, and now the belly, and now the hips. And then you stop there, now we're in extension.
Yeah.
And then if we now tuck the hips in, and tuck the abs in, and tuck the ribs in, and tuck the chest in, and the shoulders forward again, we're back here.
Yeah.
So then if we just keep going through that.
That feels really good actually. I'm not sure I can do it that much.
Yeah?
Yeah.
So in a way, it's similar to what breakdancers do. So when they achieve this fine level of control, they'll start popping and locking, right? So like little bits of things like this, so they'll be here, like this, right? So it's all just about articulation of joints to be able to have neuro control of all the directions.
So articulate through the whole spine, all your joints for mobility and anti-aging benefits as well.
That's it.
Ricky's going to show us 2 exercises for releasing the hip flexors because they get super tight when you spend all your time sitting down.
Just going to go down onto one knee, like a lunge, yeah?
Yeah.
And then we want to draw the glute in from underneath, to squeeze that back glute tight.
Yeah.
And then we want to just press forwards with this knee over the toes until you feel a stretch in the front here, yeah? Then we want to hold your hips here and just push down a little bit so your hips are driving to the floor. Feel that?
Yeah.
So that's called a couch stretch for the obvious reasons. So yeah, so we'll do that on both legs.
Do the other leg as well. So we do our couch stretch to stretch our hip flexors out.
Remember to squeeze that glute at the back. If you don't squeeze that glute, the pressure's going to go in your lower back and make it a bit worse. Yeah, so driving the hip down. The second one, we're going to go onto our knees. Yep. And then just put your hands behind you, and we'll just lean back as much as we can, and then push the hips up with the glutes. You feel that? So what we're stretching there is the top quad, which is called rectus femoris, as well as a bit of the hip flexor, and because they work together as a unit. So if we stretch hip flexor and rectus femoris, that's going to help from the symptoms of sitting down a lot.
So do that after sitting down for a long time during the day. Where can people find out more about you?
My website, www.bodyweightgurus.com, or Instagram is where I upload all of my latest videos and my exercises. So I do a lot of strength work, calisthenics, rings, bars. That's Rick's Official, RIX.official.
We'll link that in the show notes. Thank you so much for your time. It's lovely working with you. Thanks a lot.